Along the road to recovery, Gene Bluen and Alicia Stetson take it step by step and bus by bus. Years of heroin addiction left these two without a home, job, or family, only each other.
What would I do without him? I don't know. I don't know. This is my best friend.
And together these best friends go once a week on a day-long trip to see a doctor.
Be on this bus for another, 15 minutes?
12 buses over 12 hours. They travel from New Britain to Madison and back.
So we start off at the house around 7:30. We get on the 5:10 bus.
That takes us downtown New Britain.
The 5:01 bus at 8 o'clock.
Which takes us to Meriden.
Takes us to the Meriden Mall.
And then we get on that bus
to the Meriden train station.
And the C bus takes us to Haven. That takes about an hour and a half ride.
Yep.
Get on the S1 bus and go to Madison.
At least there's a shoulder to lean on during the journey. It's their only option. A day-long trip for a different kind of drug, one that might save their lives.
We were so broken and so tired. We had no more money to get high. We were broken. We went to the library and we typed in Suboxone.
Suboxone is a drug taken daily to keep cravings for heroin at bay. It's prescribed by a doctor.
We've been doing good. We've been doing real good.
The Suboxone is really helping us.
Released in 2002, Suboxone, also known as buprenorphine, is relatively new, but doctors who prescribe it say it shows promise. So why then is this treatment so difficult to get? After all, Connecticut's heroin crisis continues to claim more lives year after year. In fact, in just the last 3 years, the number of heroin deaths has more than doubled.
It's a problem statewide.
The state's Mental Health and Addiction Services Commissioner, Miriam Delphin-Rittman, says her department is impacted by the crisis too.
There definitely is an influx, and we're seeing increasing numbers.
If any of that increasing number of addicts are looking for Suboxone, the state refers them to a federally run website. It lists doctors licensed to prescribe buprenorphine. You can see the state is saturated with doctors. So the News 8 investigators called every single one. That's when a different picture emerges. Fewer than a quarter of the doctors listed are still prescribing and taking new patients.
The number you have dialed is not in service at this time.
That doesn't include numbers that were disconnected, rang to wrong numbers, or put us in touch with offices where the listed doctor had died. Some doctors told us they had requested to be removed from the list, but were still getting calls from those looking for help. And if you have Medicaid or state insurance like Bluen and Stetson, the pool of prescribing docs shrinks even further.
You'll find all your Suboxone doctors and you just got to keep doing the footwork behind that.
Many just take private insurance or are cash only.
Just because they're on the list doesn't necessarily mean that they prescribe.
Delphin-Rittman admits the federal database has its faults, but insists the state has help available for those who need it.
If an individual is having a difficult time getting connected to services, we really encourage them to call us and to be in contact to let us know that, because we have capacity.
Others on the forefront of the crisis say that addicts seeking help are left in a lurch.
The state of Connecticut, the citizens need help.
Courtney Labonte has seen the toll of heroin addiction in her family, so she started a website, ctsuboxone.com, to connect others with the treatment she believes in.
But the average was a bundle a day. It's getting harder and harder. There's not enough doctors to meet the need. Things are gonna be okay.
7 days a week, from her living room, she is on the phone.
If I don't do it, who will? I can't just stop now.
A few months ago, Labonte got a call from two addicts living under a bridge.
Dr. Bono, it's good to see you this week. Thank you.
And today, thanks to Labonte, these two addicts are meeting with Dr. Mark Bono at the Center for Compassionate Recovery in Madison.
Keep trying and trying, and being that consistent, it's got to come along.
Most of my clients in either practice that I'm involved in come to me after a very long struggle trying to find anyone to get services.
Dr. Bono opened this clinic after turning away people with state insurance at his previous job.
That was constantly on my mind. That was a year-and-a-half battle of, is there a way to make it work?
He knows how to make it work, but he can't meet the demand alone.
Someone who's in the throes of an opiate addiction, who's reaching out for care, they need help now. 3-month wait, it might as well be on the moon.
There is a waiting list for the clinic, even after opening only a few months ago. Dr. Bono says people call hoping there's a spot open every single day. But even with a doctor, Bluen and Stetson have a long road ahead. For now, they're taking it one bus at a time.
We're deciding every day to stay clean.
Hoping those dark days are miles behind.
My worst day clean is better than my best day high.